Today is International Human Rights Day. We commemorate the day in 1948 when the United Nations General Assembly adopted the Universal Declaration of Human Rights. And Article 25 of that document states, "Everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and the necessary social services. And the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond his control." And we are here today to urge our leaders to pass legislation that will provide access to health care for all Americans. The details of various bills that have been working their way through Congress this session have a way of changing, as we've seen, particularly in the last few days. But the panelists who are here today are here to talk about core values, our core values that must be present in the final legislation.
This is a historic moment in time that we're experiencing together, and I know that the people in the room, in their way, and the people that you represent have done a lot of work over the last 15 to 20 years to bring us to this point. This is not an aberration based on an election last fall alone. Where we are in time today is the result of years and years and years of work of union members across a variety of unions represented by the AFL-CIO. And I'm glad that we're here together today at this point where we're so close now to passing federal reform. I'm grateful to be serving on the White House State Legislators Working Group, and it's been an opportunity for me as a state legislator to try and continue to advocate for the federal reform and for affordable coverage for everybody. And I'm really happy to be part of this panel today.
First, I should mention that we spend $95 million a year on health care. It's the biggest thing that we do. We're a construction union. That probably surprises some people, but a lot of the construction unions are in a similar boat. They all have multi-employer funds that spend a ton of money on health care. So our members have a vested interest in making sure the system works properly and is efficient and is cost-friendly and all of that stuff. So that's sort of our perspective on this. We'd like to see the debate focus on a few things. We obviously support 100% the need for access for all Americans. That's a huge point. We support it. We don't want to see our benefits taxed. We think that middle-class Americans pay enough taxes, and we shouldn't be taxed.
We pay $220 out of every paycheck. My husband's paid every 2 weeks, so that's 26 paychecks a year. Our deductible for a family plan is $5,000. After we pay the insurance, Social Security, and Medicare, my husband brings home $430 every 2 weeks. How am I supposed to take $160 out of that paycheck, possibly every month, to pay my payment on one of our office visits? And that doesn't even include the labs. If I go to the doctor and don't have any labs and talk for 10 minutes, it's $130. If I have one blood test, it's $160. We get the little discount that Blue Cross Blue Shield provides agrees with the provider. But until we make that $1,250 per person or $5,000 per family, that's what I'm stuck paying. Now, my children are all adopted, and my 14-year-old was a special needs adoptee, so we receive medical assistance through adoption assistance. If we didn't have that, he was hospitalized at the Children's Mental Health Unit earlier this year at Fairview. Our insurance denied the coverage. Flat out, absolutely did not cover a single dime, no discount, nothing. If we did not have that medical assistance as backup for him, we'd be bankrupt right now. His bill came to $35,000. How am I supposed to pay that out of $430 every 2 weeks?
And these could be hardworking people. We need to have full access to health care for everybody. It must be equal access, and there must be access to preventative care. not just to sick care. If we don't have that, we cannot afford the payments. They're going to be too high in human suffering, in money, and absolutely too high for our own consciousness. And we're too good people for that, in my opinion. Thank you.
But what we don't want is what the Senate bill does for us today. We prefer the House bill to the Senate bill because the Senate bill, we feel, gives up on a real public option that can drive costs down. What you do is you force our people to give up their insurance. If you have a tax, the 40% tax on the providers, that cost is going to get passed on to us so that we can't afford our insurance. If you want to tax our benefits that we have already struggled to pay for, that we have bargained hard and made wage concessions in order to keep, you hurt us. You cannot ask the middle class, the workers, to pay to insure the uninsured. We have to ask their employers to ante up and pay for that, and we have to ask people who are doing well, who aren't hurt by the current economy, to come up and pay their fair share so that health care is a human right and it's quality, affordable care that everybody can have access to.